Hi, this is Dr. Cannell. In one of an ongoing series of short comments I'll make about recently published papers. This is a paper due to come out in May of 2011 from a group in Texas. Joshua Perry is the author. He's a medical student down there, and Dr. Allison Cooper Scott is at the Shriners Hospital for Children in Houston. They went back and looked at children that were admitted for bone surgery called osteotomies. Osteotomy is something that is used to lengthen a bone or shorten a bone or change an angle to a bone. They had 70 children undergoing osteotomies with various diagnoses, cerebral palsy or leg length discrepancy or scoliosis. They had both children who had injured their bones and would have been active until the surgery, or they had children who were chronically ill. What they found was that 90% of the children had vitamin D levels less than 32, 50% of the children had levels less than 20, and 16% of the children had levels less than 12 nanograms per milliliter. That's getting into the rachetic range. Yet, surprisingly, they found no difference in the levels between the children who had had acute injuries, who apparently should have been active before that injury, to children who had chronic disease, who you would think would be inside more. The second thing that was surprising is they found very little difference between the summer and winter levels. Levels in the winter were 18 and levels in the summer were 22. This adds to my fear that American adolescents are not getting outside at all. In fact, one of the most dramatic sociological things you can see today is go to a community where there are lots of children on Saturday when they should be outside in hopscotch and playing ball, etc. And they're all inside with their video games. What the effect of this is going to be on these children as they age, nobody knows. But remember, vitamin D deficiency causes diseases with long latency. So these children may pay for this in their 40s, 50s, 60s. The authors concluded that they're going to start giving vitamin D to the children before they operate, which I think is good, and they started an education program for the family. So congratulations to Mr. Perry and Professor Scott for a very good paper.